Medical interviews, particularly for core training, CT, and specialist training, ST, are highly competitive and rigorous. They typically involve multiple stations, each lasting around 10 minutes, though this can vary. Some interviews might have fewer stations with more time at each, or more stations with stricter time constraints. A few retain the traditional 30 to 45-minute panel format. Knowing the specific structure of your interview is crucial for effective preparation. Formal interview stations. 1. Portfolio station. This station can be either formal or informal. In formal settings, candidates might be asked to summarize their experience within a set time frame, discuss their CV, or detail specific areas of their training. It's essential to bring evidence to support any claims made in your application, such as certificates from courses or copies of publications. 2. Motivation, interpersonal skills, and NHS issues station. This station assesses your reasons for choosing the specialty, or as well as your communication, teamwork, and leadership skills. Questions can be both general and specific, sometimes touching on current NHS issues relevant to your specialty. 3. Academic station. Designed to evaluate your understanding and experience in teaching, research, and audit, questions at this station can range from factual inquiries about the audit process to reflective questions about your research experience. You might also need to critically appraise a paper, for which you'll have some preparation time, or discuss a recently read paper. 4. Clinical governance station. Questions here focus on clinical governance, evidence-based medicine, risk management, and related topics. You might be asked to explain terms like clinical governance, discuss recent guidelines or papers, and reflect on your own experiences with audits or teaching. 5. Dilemmas, difficult scenarios. Station. This station tests your ability to handle challenging workplace situations. Scenarios might involve managing multiple urgent tasks, dealing with a lack of qualifications for a necessary procedure, or responding to unethical behavior from a colleague. Practical interview stations. 1. Communication station. In this station, you interact with a simulated patient, often played by an actor. The focus is on your communication skills rather than clinical knowledge, assessing how you approach and address patient concerns. 2. Presentation station. Candidates must deliver a short presentation, typically followed by a Q&A session. Topics might be given in advance or on the day, with some preparation time allowed. Past topics have ranged from personal motivations and interests to current political issues affecting the specialty. 3. Group discussions. Candidates discuss a given topic in small groups. Discussions can be straightforward debates on hot topics or involve role-playing different stakeholders in a scenario. This station assesses teamwork, communication, and the ability to argue a position effectively. 4. OSCE station. This station tests clinical skills through practical tasks like examining a patient, taking a history, or performing a procedure. Specific tasks can vary widely by specialty, from suturing in surgery to intubating a dummy in anesthetics. Preparation tips. Know the format. Understanding the specific structure of your interview allows you to tailor your preparation. For example, if you have limited time to answer questions, practice delivering concise, impactful responses. Evidence and experience. Bring supporting documents for your claims, such as certificates for completed courses or copies of your publications. Be ready to discuss your experience in detail, using specific examples to illustrate your skills and achievements. Communication skills. Interviews are primarily a test of your communication skills. Practice explaining complex concepts clearly and confidently. Use frameworks and checklists to structure your answers logically. Handling scenarios. Prepare for scenario-based questions by considering how you would handle common dilemmas. Think about prioritizing tasks, managing emergencies, and addressing ethical issues. Practice articulating your thought process and decision-making rationale. Presentation skills. For presentation stations, practice delivering clear, engaging presentations on a variety of topics. Be prepared to answer follow-up questions thoughtfully. Group dynamics. In group discussions, focus on effective communication and collaboration. Practice discussing topics with peers, emphasizing active listening, respectful debate, and consensus building. Clinical skills. Ensure your clinical skills are up to date. Practice relevant procedures and review clinical guidelines. Being competent and confident in your clinical abilities is crucial for practical stations. Reflect and learn. Reflect on past experiences, both successes and failures, and be ready to discuss what you learned from them. This reflective practice demonstrates maturity and a commitment to continuous improvement. By understanding the structure and expectations of each station, preparing thoroughly, and practicing consistently, you can improve your performance in medical interviews. Adapting your preparation to the specific requirements of your specialty will help you present yourself as a confident, capable candidate.